So welcome. So Darleen and I worked together, and we worked very closely on this project in 2017. So I'm going to run through a few slides that we prepared just because we have some great pictures and stuff like that. And then it's really open for discussion and questions and conversation and anything that we want to talk about our community challenge grant, or maybe the process itself also. In 2017, I believe it was the first year they actually had community challenge grants through AARP. We applied through the City of Garfield. Well, let me first introduce myself. I realized I didn't do that yet. So my name is Shannon, and I work for NYU School of Medicine, who had a partnership at the time with the City of Garfield to do community engagement work. We had a history of working in the community on some environmental health issues. And Darleen, do you want me to just introduce you?
Sure.
Darleen is retired now, but was the public health nurse in Garfield for many, many years. And so she had a history of great community work in Garfield. And this came across our desks just as we were getting our age-friendly initiative up and running in Garfield. That began in 2016. And we were working on the survey and the survey results. And then this award came across our desk in the summer of 2017. We applied with the idea for 4 pop-up wellness center events. So we picked time. We were notified in July. The work had to be done by the end of November. And so we said we'll do 4 pop-up wellness centers in October and the first week of November. And we're going to plan out the day. I'll go through that in a little bit. I brought some sample documents that we used, and it included cooking, arts, music, exercise. We wanted something fun, but we wanted to also, we wanted it to be somewhat educational, so to speak, at the same time. So this is just some of our sort of marketing materials that we use. So we had 4 Wednesdays. We partnered with Hackensack Meridian Health, who provides nursing services or support for the City of Garfield. Also, AARP was our funder, the Henry and Marilyn Tabb Foundation, because we were doing this through our age-friendly initiative, and NYU was my connection also. But we had an entire room of partners and agencies from Garfield and the surrounding area that also partnered with us and came to meet all the people that attended and provide information and conversation, and helped people increase their knowledge about what was available to them in Garfield and the surrounding area. So this was our flyer. This was our agenda for the day. It ran 10 to 2 o'clock on the 4 Wednesdays that I mentioned. Each one had the same format. Each one had a beautiful lunch, and each week we also provided a pretty substantial bag of produce that went home with them, just to underscore that we were really focusing on wellness and really wanted to provide them with something that we thought could be useful after having been through cooking classes and exercise classes. So the famous saying, pictures are worth 1,000 words. So these are just some of the photos from our day. We hosted the event at the VFW in Garfield, which is a beautiful space that we've used many times, and they're a great partner for Generations for Garfield. So they were doing exercise. This was chair yoga, but we had a different exercise class every week. This was the food market outside, the farmer's market outside as they were leaving. And then this is the cooking class. They have a full kitchen in the VFW that had enough space for about like 10 people or so to comfortably watch and then cook also at the same time. And then we provided tech support classes and art. We called it arts and culture, where people could sit and kind of get their hands dirty and do something that was just fun and enjoyable, and they could take it with them at the end of the day. So what's interesting about this project and this grant, we did do a survey at the end of each week, and that was just valuable for us to understand who was coming to the event and who we were serving with this project. And you can see here, we had an age range of 54 to 92. This is over the course of the 4 Wednesdays, but the overwhelming majority of people that came were Garfield residents, which was helpful for us to know. The funding that we were awarded went through the City of Garfield, so that's important. And at the time, this is pre-COVID. This is greatly before 2020. So we were able to use the walking club. The senior center was still having people attend in person every day, and word of mouth. And we did do some advertising, and EJ was our social worker at the housing building at the time. So she actually helped spread the word quite a bit for us. And we also asked for their feedback, and this is important because we wanted to have a little bit of a discussion about how successful the program was and how happy people were with their experience. And we also asked them what they would want to do in the future if we were to host events like this moving forward. And they asked for blood pressure screenings and diet tips and more dancing and exercise, and then more activities, which we have used all of this feedback to continue programming in our age-friendly initiative. And so we'll talk a little bit about that in a minute, a little bit more about that in a minute. But I just wanted to show you this last slide about our Community Engagement Center that we opened about a year and a half after the Wellness Center events, which was really a space to continue all of that programming. So we had this pilot funding to do these 4 pop-up Wellness Center events, host something in the community, see what people thought about it, gather some data, and really see that we needed a space to be able to host those events moving forward. That's what people were looking for. And so we renovated a 3-bedroom apartment in one of the housing buildings in Garfield. And actually the Community Affairs Division of the police department, their office is there. Sergeant Stewart is going to be presenting later today on collaborative policing and the work that he does, because we all do work together kind of as a coalition in our age-friendly initiative. So this is the space. It's renovated with a kitchen and sort of gathering space. There's technology there that we can do presentations and recording and collect recipes and things like that. So really this pilot project sort of culminated in the opening of this engagement center, which was also pre-COVID. We're getting back into the groove of in-person activities and being able to use the engagement center now. And I think Darleen will do a great job elaborating a little bit on some of the programming that came out of the Wellness Center and our opening of the engagement center. Do you want to talk a little bit about diabetes prevention, which actually was right in this last slide. I realized that last night looking through diet tips and weight loss advice is something that people wanted to see moving forward. So we definitely were able to implement that in a sort of multi-generational way. So I don't know if you want to add anything to that. That's actually my last formal slide. And certainly if anyone has questions after.
I think you did a great job, Shannon, of giving an overall overview of the project. And what is near and dear to me, as I had been the public health nurse since actually started in Garfield in 1987. So, and what's so special about this is we actually took this investment that AARP generously gave us, but that translated into what the community actually wanted. And we were able to take these activities that were piloted in the wellness pop-up and implement them in programming going forward. And they are still being conducted even throughout COVID. We managed to switch over to some virtual projects. The partners that were established came forth and helped us to meet the needs of the residents during that time. And, we are still conducting those pilot programs in the city today through the engagement centers, through our senior center, and as a space in the VFW. So I think because we're supposed to be more of a tabletop, I'll just open it up to all of you and you can ask questions, and we'll be happy to explain any areas that you would like us to.
Perfect. You don't have to use the raise hand icon either.
Well, this is Candace. Thank you so much for sharing that. I have a question. I appreciated the slide on a word of mouth or how they found out about it. But what do you think is for two questions? Where did a majority of the folks come from? Were they living in their own home independently, and this is where they're coming, or were they living in a senior subsidized building, or was there a mix of kind of growth? And I'm just curious about that. And then secondly, what's kind of the key factor you thought that drew folks in to really be engaged and keep coming back? I would assume that you had a lot of repeat folks that came back every week looking for more opportunity. And so I'm just curious if you can speak to those issues.
Sure, I think I could. Well, there was a definitely mixed group. It was promoted throughout the community, and we did provide transportation. Garfield is fortunate enough to have its own senior bus service. So they did a loop, the regular loop throughout the community, and they stopped at each of the senior housing. We have 4 senior housing residents. So the transportation wasn't an issue to get people there. And I think after the first group, we actually had a pre-registration, and we were accommodating some welcomes, but this is the first time. And having said that, I've been in the city for decades. I've never had a program that was so well attended. And I think because we really put forth the effort and we had the funds through AARP to make it really quality, so that we had one of our caterers that has like a 4-star rating do the lunch. We had a DJ that came, and the YMCA facilitated the exercise class, but it was to this amazing music. We had really quality presenters. We worked with Reveille College of New Jersey, their nursing program. They were our tech advisors that came and did the tech class. We had an amazing arts and cultures teacher that was an older adult herself that really connected. The supplies were quality. We had the nutritionist from Hackensack University Medical Center who does the diabetes prevention program there, as well as other chronic disease prevention programs, that came and led the cooking class. And we had Maschio's Food Service, which is our food service for our schools, and caters all other events in the city, come out and put up that pop-up produce of fresh produce. So word of mouth. So in the beginning, as you saw on the slide, it was through all those methods that we were promoting it, but the word of mouth was key. That spread through the community so quickly that we actually felt so terrible that just for the capacity, we actually had to turn people away and kind of not allow repeat attendees. So we tried to make it so everyone in the community who wanted to come had an opportunity. And then when it was over, after the 4th week, people were calling the health department saying, "When are you going to do that again? I didn't get a chance to come." And they were actually asking. So truly, we put it out there, and we heard what the community wanted to participate in, not what we thought they should participate in. And those were the activities that we were able to implement going forward in other health programming.
Gotcha. Interesting. Thank you.
Yeah.
Hi, I'm wondering if you could share a little information about the grant, like how that worked and whatnot.
So we, again, we were the first year that they put out the call for funding for the challenge grant. I believe the maximum you could apply for was $10,000. I don't know if that's still the case. So we applied for $10,000, and that's what we were awarded. And so we essentially split that up to the best that we could to plan out these 4 weeks, so that we made sure we had the food and the resources that we needed for each week, because you have a budget when you submit the grant. So the idea for the challenge grant, and I believe this is still the case, is sort of to pilot an idea. Oh, we should share our video. We have a great video that AARP did that really explains what the challenge grant is all about. They went out to each site that year and did a recording. They interviewed Darleen. They took some footage from the actual event. And to finish my sentence, the idea is to pilot something that you can translate into a more permanent, either program, service, or I guess even more concrete space moving forward. So you want to demonstrate that you need something in a community. So that was our goal, which is, Darleen was kind of speaking to that a little bit just now. Yes, assessing the needs of the community, and we had just done our survey also. So we had a little bit of data and really kind of understood what people were looking for, but this solidified that by, having 50 people show up every week and understanding what they needed and what they wanted. So we tried to write that, oh, we have 5 minutes. We tried to write that into the grant and just talk about how we would use that experience moving forward to something more permanent. So I
Great,
think
thank
we
you.
were pretty happy with that because we were invited to talk about it to all of you. So any other questions? I thought this was going to be a lot of time, but we're already up against our last 5 minutes. So we're
I
doing.
just have one little question. Now that you're going to a location, do you think that will change folks, you know, I don't know, just the level of folks having to get there? I mean, we've heard like there's a stigma of like, oh, I'm going to a senior center, you know, like kind of is there a concern about the change in just location? I'm not saying that there would be. I'm just curious as you're thinking of moving forward.
I think so. I could speak to a little bit about those activities that are ongoing. So a couple of years after we were received a grant through the Reveille Foundation to work on the diabetes prevention program. So, which was a CDC, an evidence-based program that did not have really all that good of results for people sticking with the program. It's very long, it goes for a year. So what we learned at the Challenge Grant was that if we could take those activities that support health and wellness, and especially diabetes prevention, and incorporate that, integrate it into the evidence-based CDC program, it would inspire people to stick with it and maybe have better outcomes. And that's exactly what happened. So the cooking classes went in, supermarket tours, exercise programs, and we actually have participants asking to continue on in the program instead of dropping out. So that was great. And the arts and crafts piece, the facilitator agreed to work with us, and we were able, with our age-friendly initiative funding, able to keep her. And she runs these classes every week at the VFW. They graciously are such a great partner. They provide the space, and our older adults love that. And not only is it happening at the VFW, but for those residents that can't get there easily, even on the bus that loops through, we are going out to their community rooms at each building, the same facilitator, and providing it there. So this was a challenge grant that didn't just go away. It wasn't like one and done. It was something that has continued from 2017, survived through the pandemic, and is still continuing now. So we're really grateful that that was the outcome.
Well, thank you so much for sharing that with us today. I'm so excited to have learned about it. Thank you.
You're welcome. The cycle usually, it's still, I think, spring application. They notify you in the summer. And then I think your work is towards the end of the year. I think that's still the cycle if anyone's interested in applying. Lots and lots of examples on the AARP website. A lot of age-friendly communities in the Alliance, I think, have been funded also for all different kinds of work. Everything from like, you know, park equipment that they want to pilot or space changes they want to make, whatever, you know, they need in their community. So.
And if I could add one more thing before we close, really take the team approach. What made this so successful, it wasn't one person's dream. It wasn't one agency's dream. We did a lot of work around coalition building, and we have amazing partners. Be the talent agent, lead your, go to your stakeholders and partner with your academics, with your businesses. We have a pool of very talented people that contributed to this and worked on the design. And I think that's the key, working stronger together. Coalition building makes stronger communities and better outcomes.